action. DVD demonstrates the appropriate use of a glucometer for our work in Nicaragua. The case like this should contain alcohol wipes in it. You may have to get some of your own. Small lancets in here, glucometer strips, and puncture device. This is how you use the puncture device. If you see on the sides, you can adjust the depth of penetration. Because people's hands here are thick and tough and calloused, we always go to the maximum depth. That's that long line. Pop the top, take a lancet and place it in the end of your lancet device. You can do this by hand. This just makes it a lot easier. Push it in, twist it off. There's the sharp end. And I carefully put my cover right back on top. When I push it in, that's what cocks the device so that it's ready to fire. Pushing the button fires it. Click, pull it back, cocks it, fire, cock. It's now ready to fire. Get your machine ready. The machine will turn off automatically in a few minutes, so when you pick it up, it should be a blank screen. Inserting the glucose test strip is what turns it on. You shake it out. These are a new type of machine that takes a much smaller drop of blood than most glucose test strips that you have used. A big advantage is you don't have to stick it in the painful, sensitive area of the tip of somebody's finger. So the strip has a little square end. This is what tells the machine what to do with it. This is the end that the blood goes in. So if we stick that in here, if you stick it in the wrong way, the machine won't go on. It won't even fit in there backwards. If you try putting it in upside down, you'll find nothing happens. When you put it in the right way, the machine will come to life. That's showing us F4. That's what tells us we use the right type of test strips, which are code F4. If you're using the wrong strips, that code on your machine should always match the code on your test strips. Now you can see on the machine it's asking for a drop of blood, and it'll keep flashing that way. This is the way we get the blood. You may have seen many places where they do it on the fingertips. Don't do it there. It's very painful. There's a lot of nerve endings. Go to the side of the hand. Many fewer nerve endings. Using your alcohol, scrub vigorously. These people may have been working in the field. That hand may be very dirty. Turn that alcohol strip over. Scrub, 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 so that that skin is good and clean. Then wait for that alcohol to dry. If you do it when the alcohol is still wet, you'll get a false reading. I will often scrub with alcohol before I put my test strip in and get my lancet out, and their hand is just sitting there and the alcohol is drying. Taking my device, making sure that it is cocked, push it against the skin to indent the skin, then push the button, firing off the lancet, which creates the drop of blood. Squeeze it, and that's all it takes, a drop about that big. A tiny drop is all that you really need for this machine. Touch it to the device, and it'll be drawn up by capillary action, and you'll see a flashing on there. That's saying it's starting to read, and in, 5 seconds or so, you'll see a number flash there. It's upside down. There you go, 124. My blood sugar is 124 because I've been drinking sugary Powerade all morning. When you're done, this goes in the trash. It is not biohazardous. You take this, pull the top off, remove the lancet, and drop it in the sharps bucket. Close it all up, zip it back up, and you're done. The end.